when you think how many people have systemic hypertension, this becomes a large population which is at risk of being resistant to drug therapy.
Renal denervation therapy is evolving as an alternative to drug therapy due to refractory hypertension in many patients despite medical treatment, as well as the issue of non-compliance in many patients who are reluctant to take more than one medication.
The ultrasonic delivery of energy by the Paradise device developed by ReCor is unique in that it is able to effect a circumferential delivery of energy to cause renal denervation with minimal damage to the renal arteries themselves. It is easy to insert, it seems to be safe, and it seems to be highly effective, offering many advantages over current technology that's available.
The ReCor Medical Percutaneous Renal Denervation System, Paradise, utilizes a novel ultrasound-based system for treating patients with resistant hypertension. It has been scientifically established that hypertension is related to a hyperactivity of the sympathetic nervous system, and that denervation of the nerves running around the main branch of the renal arteries to and from the kidney can significantly reduce blood pressure. The Paradise system consists of a novel ultrasound delivery catheter and control unit, which together manage the uniform delivery of ultrasound energy with the aim of disabling the nerves that lie in the walls of the renal arteries, while simultaneously cooling the surface of the artery wall to help prevent damage during the energy delivery process. The 6 French-compatible Paradise catheter is inserted through a standard renal guiding catheter and advanced into the renal artery. The Paradise catheter is advanced to the distal end of the artery, where there is a high concentration of sympathetic nerve activity due to the branching of the nerves just behind the arterial wall. Recent scientific research has indicated that a majority of the nerves are located up to 2.5 millimeters at depth behind the artery wall. Through a proprietary algorithm, the Paradise control unit regulates the inflation of the balloon with a mixture of sterile water and a contrast agent, automatically centering the ultrasound transducer in the artery. The control unit also continuously manages the balloon pressure to ensure a constant, low pressure is being applied to allow gentle vessel wall contact. The Paradise control unit manages the uniform delivery of ultrasound energy circumferentially around the artery wall, where the nerves are located. The energy delivery cycle is shorter than currently marketed approaches for renal denervation, enabling faster procedure times. The circulation of fluid in the balloon during the heating cycle has a cooling effect at the surface of the artery, while the nerves are being heated and damaged at depth. The proprietary algorithm and built-in safety mechanisms ensure maximum protection for the patient during this process. The balloon is automatically deflated after energy delivery has ended. The Paradise catheter can then be moved to additional positions within the artery to provide optimal therapy. The procedure is repeated on the other renal artery to achieve bilateral denervation. Once both renal arteries have been treated, the Paradise catheter is removed from the body and the procedure is finished according to standard interventional techniques. The ReCor Medical Paradise system.
I believe the ReCor approach may change the landscape of resistant hypertension.
You will be able to reduce the amount of medication and controlling the high blood pressure and reducing the impact on these major organs. That will be a plus.
ReCor product may move renal denervation therapy to next level because it's overcoming certain shortcomings of currently existing systems, reducing patients' pain. It's simple and more precise.